Good morning. This is Dr. Tyler Hamel, Kingwood chiropractor and nutritionist. Today, talking about disc degeneration. So, oftentimes people come into my office and with neck pain or back pain, and they say, "Doc, I had an X-ray. I went to the orthopedic, and they said I have some degeneration in my back, arthritis, degeneration, wear and tear. It's all the same kind of thing." So, exactly what does that mean, and how common is it? So, disc degeneration, think about my fists are two vertebrae and I have a disc in between, right? So when the disc degenerates, this space here is going to narrow. So when this space narrows, it puts extra stress on the disc, extra stress on the nerve, and so you can have neck pain or back pain. Sometimes when the nerve is irritated enough, the pain can go, say, down the arm from the neck, or if it's in the low back, it can go all the way down to the foot. Pain, numbness, weakness, when a nerve is irritated, those are things that you can have. So let's just show an example of this is a disc. So this is two vertebrae and a disc that's in between. So you see how thick this disc is here. That's a healthy disc. We want this disc to stay as thick and healthy as possible as long as we're living, because they act as shock absorbers. Think of it that way, right? There's compression or stress on the spine. And the healthier that these are, then the better off we're going to be. The better off our neck and our back is going to be, no question. So, disc degeneration. I always equate it to like a jelly donut when you squish and the jelly comes out the side. So what does that look like when we look at the vertebra? All right, so you can see here, the disc is degenerated, right? It is squished down significantly. And when it squishes, it can put pressure on the nerve, say this one right here, that's coming out of the spine. If there's pressure on that nerve, wherever that nerve goes, you can have pain, numbness, weakness. So we look at conditions like low back pain, we look at disc bulge, disc herniation, degenerated disc, sciatica too is involved sometimes, all those different things. So how common is disc degeneration? Super common, right? There's so many people coming into our office that say that, again, they went to orthopedic, they had an X-ray, and there's degeneration in there. So is that a bad thing? Not necessarily, right? Like as we get older, the disc is going to degenerate to some degree, but it doesn't mean that you're going to need surgery. It doesn't mean you're going to be unable to move your back, or you're going to be crippled for the rest of your life. It's just not true. So probably, half the people coming in here with neck and back pain have some kind of degeneration in the disc, in the neck, or in the back. So guess what? It's something that we can help with. You're still going to have some disc material in there. So the idea is to keep it as healthy as possible, even though it's already degenerated, right? We don't want it to degenerate more. We want to keep it as healthy as possible in the state that it's in. So how do we do that? So spinal alignment, that helps take pressure off the disc. So that can only help, right? Movement of the spine. Exercises, corrective exercises, keeping the disc well hydrated. There's different supplements you can take, but anything we can do to keep that disc hydrated and healthy, even though it's already degenerated. So again, what can be done? Supplements, getting the disc healthier, chiropractic adjustments, realignment, taking pressure off the disc, right? So even if you have a diagnosis of disc degeneration, don't give up. There's so much that you can do. You don't have to get surgery. It's not necessarily a surgical thing. So if you have any questions about that, if you have back pain or neck pain and you have degeneration and or arthritis and you're looking for some kind of help or some kind of direction to go in, you can certainly contact our office, and we'd love the opportunity to help. Come in for an exam and I'll let you know exactly what I think is going on and what can be done about it, and the process to try to get from where you're at now to a better place, right? A healthier place, less pain, more function, more movement. If you have any questions about the video, put it in the chat box below. It's early Friday morning, but if you put a question in there, I'll definitely look back and try to answer all those that I can. And like I said, we just love to help. There's lots of people with back pain, neck pain that have disc degeneration, degenerative disc disease, and they're not quite sure what to do or where to go. And just remember, you can always do pain shots and medicine, and there's a time and a place for that, but that is not really ever fixing the problem. It's kind of masking the symptoms. It might make you feel a little better, but in no way is it going to help improve or increase the health of that disc. So again, Dr. Tyler Hamel, happy Friday morning. Kingwood chiropractor and nutritionist. If you have any questions, put it in the chat box. If you learned something from this video about the spine, about disc degeneration, what it is and what you can do, how common it is, share it, like it, tag somebody in there. There's lots of people in this area in Kingwood that are struggling with this condition right now. And this might help open their eyes a little bit, at least educate them on what it is and what they can do about it. Thank you very much for watching this video.